You don't need to go to the AMA at all for anything, unless you're in a car wreck and you lost an arm, or you need surgery, or you need first aid real quick, or you have a heart attack, you feel like that, yeah, you're going to go to the ER. Allopathic is emergency and surgery. Diagnosing, they're lost in diseases, they don't exist. So if you want to fight and treat diseases, then this isn't the channel for you, because you'll never get well. Because that's what's been going on for, what, a couple of 100 years, and all we see is about, what, 1.5 million people killed each year, at least now, if not 2 million worldwide. Worldwide, it could be all the way up to 10 million. So you're asking me about something here that is very dear to my heart, is that you guys have to start empowering yourselves and get away from this medical, I need to have a medical doctor tell me, because that's the problem. And it's fear-based, and the problem is it's taking the truth, and it's taking the understanding and the control of your own life out of your hands. And now we have a modality that's extremely out of control. Extremely out of control. And when you start setting up one modality, in America it violates antitrust laws. When you say there's only one health modality and it's not God-driven, then it's money-driven and pharmaceutical-driven, there's something wrong with your thinking. And it's just what we've accepted in our world. We've accepted, oh, we have to have a medical diagnosis. Do you really? I have people that have had the worst cases of cancer and everything else, never diagnosed, went through that, and cleaned them right out. You could tell they had the cancer cells. Big tumors everywhere, never diagnosed, went and cleaned them right out and got the cells well again. Why would you need to be diagnosed? Now, if you need to and you have some pain, you really want to see what's up, they got the nice equipment. I don't mind that. Get digital CAT scans, not so bad if you get digital. Your CAT scans, though, you have, what, 260 some rads or something like that? So, you know, some of the diagnostic procedures are cancer causing. Is that what you want to put yourself at risk, especially if you have a lot of inflammation in there and just that radiation? Look at the mammograms, cancer causing. Not deniable at all. The only reason the government backed off on them was the ladies out there insisting that they need them. Those are the poor souls that didn't realize that's part of what causes cancers, mammograms. Radiation is a big problem. If you hadn't noticed, it's a big problem from computers. It's a big problem coming from your TV set. It's a big problem. Radiation is cell destructive. So it's real important to look at these things and to realize, heck yeah, you each can fix your body no matter at what level you're at. We have the most mutated beings we've seen, and their body realigns itself, pulls himself back straight. You could have an allopath that can't do any of that stuff. So why would you go to an allopath if you need a diagnosis, you felt like you had somebody to say, but if you want to diagnose about a disease, then I think you're off kilter. But if you want to have an area looked at to see if you have a tumor there or see what's up, absolutely. Get an ultrasound or something. I love ultrasounds. I looked at a lot of hearts and things before in my life. I have no problem with that. But don't think that you need an allopath to get yourself well, because that's the problem. These guys are not known for that. There are some good allopaths. Don't get me wrong. There's some good medical doctors out there. But those are the ones that are doing this. Those aren't the ones that are giving you the pharmaceuticals. These guys are dangerous. And you must protect yourselves. If you feel like you have a tumor or something, you want it looked at, by all means, of course, just take the least toxic procedure or diagnostic procedure you can. At least get the least toxic one. Protect yourselves when you do. Try to get digital CAT scans and stuff like that. Then you'll know where the problem is, and now you can know you already know what you're going to do no matter what you find. Because there's only so much in the body. You have to understand, it isn't like, oh, there's all this stuff going on and we don't know anything. It's a mystery. The body isn't that big of a mystery, guys. You got a bunch of cells and two major fluids to take care of them. Nutrition in, sewage out. So you realize that you have to get in and clean out the human body no matter what. Because you know that it's the acid side of chemistry is causing all the inflammation. You know that when you have a swelling or a tumor form, that there's something, a fluid is stagnant. Because a tumor isn't a cell, a tumor is a pocket of fluid. So when you have a tumor growing or a cyst growing, that means there's a fluid that has become stagnant. Well, which fluid? You only got blood and lymph, take your pick. See where I'm going with all of this? So that's what I'm saying, is that that's a focus no matter what your diagnosis is, because there's only two systems in the body that's taking care of your cells. I mean, it's almost like some modalities out there think that there's this endless world of diseases and the bacteria on the planet are attacking you and, you know, all of this sort of thing. And this is the very thing that's got man into trouble. It's got him scared to eat, scared to death. We radiate our foods to death. We destroy our very foods because we're afraid of bacteria. And yet there's nowhere you're going to go that there don't exist. You can even be the little boy in the bubble, and they'll find you. It's just, these are serious microbes, and they have a serious job to do.